All right, everyone, welcome. We're going to go ahead and get started with the presentation. Thanks for joining me. I'm Dr. Sally. I'm going to be talking to you a little bit today about Regenx, the trusted alternative to orthopedic surgery. So let's get started. So with this webinar, you guys are going to learn a couple different pieces of information. Number one, you're going to learn our three-step process with how we perform our procedures and how we get people set up and evaluated for their consults. We're going to talk about where we get the cells from and why that's important. We're going to talk about how the cells work and how these different treatments work. We're going to talk about how these treatments can help with not only pain relief, but also getting you back to activity. And at the end, I'm going to take some questions to address any of your concerns. So who am I? I'm Dr. Jess Sally. I am a Pittsburgh native, grew up in Fayette County. I had my bachelor's degree in human nutrition, foods, and exercise from Virginia Tech. Did my subsequent medical school at the Virginia College of Osteopathic Medicine, also in Blacksburg. I am a certified physician, board certified in physical medicine and rehab, and also additional fellowship training in sports and spine medicine. I'm an avid snowboarder in the winter and a cyclist in the summer. So this is our Regenx team of doctors, myself, Dr. Lieber in the middle, and then Dr. Adelsheimer on the far left. We are all board certified physicians in physical medicine and rehabilitation. Dr. Lieber and Dr. Adelsheimer also have further credentials in pain medicine and spinal interventions. We have locations all over the Pittsburgh area, our main office being in Fox Chapel, which just is a little north of the city of Pittsburgh proper. We've been a part of the Regenx network since 2012. We've performed over 25,000 or 2,500 stem cell procedures and over 10,000 PRP treatments. So in the continuum of healthcare today, there's a gap in orthopedic care that kind of runs from your typical pharmaceutical management and also typical steroid injections that people will get for joint-related pain or pain symptoms otherwise. The next step, you follow up with maybe your primary care doc. You get sent to physical therapy or maybe some chiropractic care. There's also some additional conservative care, maybe with bracing or something else that could be taken care of at that point. And if all that doesn't work, the next step is usually maybe surgery. But what Regenx is trying to do is create an intermediary between the need for conservative management that fails to manage pain and then further surgery. The reason for that is that there's not really great evidence behind the outcomes with orthopedic surgeries. So the evidence for orthopedic surgery is relatively unfavorable, and a large amount of randomized control trials show that that surgery is not superior to a non-operative alternative. 53% of surgeries in the United States have been shown to be overall ineffective in clinical trials. But if we look at how many surgeries are performed per year, this is what's currently covered under your health insurance plan. But what percentage of these orthopedic surgeries are actually useful? And there's so many of these surgeries and so many of these treatments that happen throughout the course of the year. But also the major thing is that there's a lot of really negative side effects that can happen as a result of surgery, big complications that can come with that, including heart attack, stroke, death, blood clots, infections, all these other things that nobody wants to go through or deal with. So instead, the goal is to let the body heal itself. And the premise of this is that surgical orthopedics really won't be the dominant form of care in the 21st century. If you look at meniscus surgeries, 95% of the time, those surgeries just remove the needed meniscus spacer. Research shows that removing that meniscus tissue actually just speeds up the onset of developing arthritis. So with the premise of let's stop cutting stuff out and instead we can use these biologic agents that actually come from your own body to help with tissue recovery and healing. Regenx is an off branch of a bigger specialty called interventional orthopedics. Interventional orthopedics is a less invasive new medical specialty that utilizes orthobiologics, meaning cells that come from your own body that are delivered by precisely guided injection treatments. It's a lower risk alternative to more high complicated risky surgeries. Within Regenx, Regenx as a network has a very highly selective physician network. So all the physicians are very highly trained They have proprietary high dose protocols for harvesting cells and for performing the injections. They're one of the world leaders in research and development for how these procedures actually work and also following outcomes. And it's a self-funded employer practice. So they're not receiving any funding from any other big government institutions or other pharmaceutical companies or anything along those lines. So interventional orthopedics, what we're looking at is going from the knife to the needle. You can think about this almost like interventional cardiology, where they stop doing big invasive open heart surgeries, and now a lot of that can be taken care of through catheterizations through the blood vessels. But with this, we're using your own cells to reduce pain and improve function. So everything comes from you and goes back into you. It's your own platelets and your own bone marrow concentrate, which is what contains the stem cells. It can reduce the need for up to 70% of elective surgical orthopedic procedures. So the delivery, as the biologics processing and delivery methods actually improve, we feel that most of the orthopedic surgery needs will be replaced by these precisely guided biologic procedures. So our goal, again, is to use less invasive procedures to avoid more invasive surgeries. And how we're doing this is through use of equipment like this. This is the setup of a typical room that you'll see in really any interventional orthopedic office. In the center here, you can see the big C arm. It's the big machine that looks like a C, obviously. And to the right of that, you can see the ultrasound machine, which also provides precise guidance for the needles. Everything in our office is processed in the office in our in-house lab. Here you can see one of the technicians processing platelets and stem cells by hand. So everything we do stays in the office. Nothing goes through any third-party processing or anybody else's hands. The conditions that we can treat are here in this list. I mean, this is a relatively comprehensive list, but there are a plethora of other procedures that we can also do. But I put this up here to basically represent, there was a big slide that we put on there earlier with all these different orthopedic surgeries that could be performed that may or may not be beneficial. But as you can see, most of those procedures we can treat using these very precisely guided biologic interventions. And you can see here, this is a patient that underwent treatments. All it is a couple Band-Aids rather than caring for big open wounds or scars or sutures or anything along those lines. So obviously that leads to less downtime, shorter rehabilitation, fewer drugs needed for pain control. You're back to work in a few days rather than a few weeks. And a lot of the time you remain awake for these, even with the sedation that we use in the office, people are still awake and alert and able to communicate. So let's go through some examples of different interventional orthopedic approaches. One of the newer ones that we're involved with now is actually using biologic cells to treat ACL tears. And we're using this under fluoroscopic guidance, mostly because the ultrasound doesn't show the view as well. But you can see on the right-hand side, we're using precisely guided needle placement to actually inject into the bundles of the ACL and actually heal that ligament without using surgery. This type of a procedure is used for the shoulder. As you can see, the dark line where the needle is in the center of the screen, that's the contrast dye that goes into the joint so that we know that we're in the joint. And just above that, where that little triangle is forming, that's actually an injection that's being performed into the labrum. So when people talk about having shoulder labral tears, that's what we're addressing. But that takes a very precise hand and a very precise guidance. Usually those tears need to be fixed surgically, but we can place those cells without just by using the needle. Here you can see a procedure where we're actually injecting cells not only into the joint, but also into the bone as well. In the picture on the far left, at the very top of that picture, you can see a bright white signal. It's actually happening in the patient's kneecap. So we're using those cells to directly inject into the bone to help heal the structure actually from the inside out. Here we're showing injection of platelet growth factors actually around the median nerve, which is the nerve that gets trapped in carpal tunnel syndrome. So this is actually the treatment that we would use to free up the median nerve through that tunnel and actually to provide pain relief and healing of the nerve compression directly at the site without having to cut that ligament. Here is a case of a rotator cuff repair for a relatively large rotator cuff tear. You can see on the left, there's a large amount of bright white fluid that's happening around that rotator cuff tear that's very isolated and outside of the joint. On the right-sided picture, you can see the tendon over top of the bone has healed nearly completely, and that joint fluid is now remaining contained in the joint because it's not escaping through that big tear that was previously there. Here is actually a patient that was treated from here in Pittsburgh. The difference in that year from March 2014 to September of 2015, she was basically a patient that had avascular necrosis in the bone and was suffering with a tremendous amount of pain. Stem cells were actually placed into the bone, and you can see the healing that happened just in that year. And she was able to get off of her crutches that she had been using for the 2 years prior to that, and is currently able to walk and has a very happy and healthy lifestyle. So how does regenerative medicine work? PRP is what we use. That's the platelet-based procedure. The platelets themselves have growth factors that are contained in them and other things that help to amplify healing. Platelets are kind of like the main espresso shots for the local repair cells. So when you inject platelets, it's kind of like the main healing element that actually happens in your body. So it's the signaling that creates all the stem cell response and the immune response, and it kind of orchestrates the repair that happens as a result of the inflammation and the healing cascade. The PRP makes the local repair cells work harder, not longer. Stem cells are basically cells that are contained in the bone marrow that don't really have a job until they're given a job. Mesenchymal stem cells, which is the stem cells that we target for cartilage and bone and tendon and other musculoskeletal tissue repair, kind of act like the general contractors for the repair job. They're actually the workers that tell other cells what to do and help to repair the damage. They're your own cells that turn into the bricks and mortar and replace the needed cells that were damaged. And also within the bone marrow, these stem cells actually replenish themselves. So it's not like you have a finite number of them where if you take some of them out and use them, they won't return or they won't grow back. Your body will make more of them. So they're your own cells. Obviously, everything gets taken out of your own body and gets put back into your body. We don't use any other third-party cells or any cells from any other blood sources. We're going to talk about the PRP. We're going to talk about blood draw examples. We're going to talk about stem cells, and we're going to talk about how we do that. It's all about using the right medicine for the job. It's also about what kind of concentrations we need, how much dose we're going to need, and the viability of those cells. So when we're taking the stem cells out of the body, we're looking at how many cells that we actually get and the viability of those cells to be able to do the job that they need to do. With the patented procedures that we have through the RegenX network, it's a very consistent that we'll get plenty of stem cells that we need to do the job that we want. And those stem cells are usually extremely viable, even into more advanced ages. So don't let anybody tell you that you're too old and your stem cells don't work anymore and you don't have enough. That's all false. So which one is for you? Usually with platelet-rich plasma or the platelet-based treatments, we're looking at smaller joints, usually less severity of arthritis, usually more in the moderate category of arthritis. Also used to treat ligaments, tendons, and spine-related instability. When we're talking about bone marrow stem cells, we're looking at larger joints, more damage, so usually more extensive arthritis or more advanced arthritis, even into that bone on bone category that everybody is worried about. We also use it for bone treatments as well. So when we're looking to inject into bone structures that are damaged. So most of our practice is about 50% PRP and about 50% stem cells. So it just depends really on what kind of issues you're having, what kind of things we're dealing with, and what we're planning to address. And we can sort of talk through what the differences are accordingly. But there is a significant cost difference that comes between the two, but not everyone needs stem cells. So that's something that we also talk through in the initial evaluation. So when we're talking about a stem cell procedures, there's actually 3 different parts that happen with the stem cell procedures. There's 3 different days that patients come in for injection. So day 1 is the pre-injection. This is kind of the preparatory injection treatment. So this is like tilling the soil before you plant the garden. So what we're trying to do is stimulate inflammation in the joint or in the structure to actually rally your body's own immune response to the area. We're trying to signal an inflammatory response or let your body know that this is about to happen. Now, usually people don't have any increased pain after these injections. It's more just a way to naturally kind of create a good environment to give those stem cells an advantage whenever they're introduced into the site. So day 2 has 2 parts. First part is the stem cell harvest. So where do we get these stem cells from? So the stem cells actually come from an area on the back side of the pelvic bone called the iliac crest. And you can see on the left side here in the illustration, we use a needle that actually goes into the bone. And you can see where that goes into the bone marrow, and we actually aspirate some of the bone marrow through the needle. And we do that in a couple different places. But that allows us to get the concentration of the cells that we need. That's an area that's very easy to access, and it's very minimally painful for patients, and it's also very safe. So after that, about 2 or 3 hours will go by once we take the stem cells out. Then we're going to take those stem cells and we're going to inject them into the area that we want to treat. That's like planting the seeds. It'll be usually 2 to 4 days after the pre-injection, and then we'll do the harvest, and then the stem cell procedure happens a couple of hours after that. The patients usually rate the aspiration as about a 3 or 4 out of 10 on the pain scale, so it's not too uncomfortable, and it doesn't last long. It's usually only about 6 to 10 seconds at each site that people have any discomfort. And then, like I said, the re-injection happens later in the afternoon after the draw. The stem cell injection itself is usually not significantly painful for patients. And usually with a little local anesthetic, we can perform those procedures relatively comfortably. Day 3 is the last day. This is where we fertilize those stem cells that we just put into the joint or into the structure. This happens again about 2 or 4 days after the stem cell injection. There's a blood draw where we actually take blood out of usually the elbow, kind of like you would be giving blood or doing any other type of lab work. We process that for about an hour, hour and a half, and then we re-inject it into the joint or into the structure. It's usually just one injection that's performed under ultrasound, and it's usually very, very easy for patients to tolerate. So when we look at the greater body of research, I had said that Regenx is actually very involved in nationwide and actually worldwide research that happens with interventional orthopedics. Right now, Regenx has one of the largest registries of patients being followed for treatments. And the nice thing about this is a registry that starts when patients come into the office at time 0. So it's not like they're cherry picking patients that have had good results. Once patients are entered into the registry, it follows their entire treatment and their entire outcome and how they feel after the treatment and how they move forward with things over years. They've also published 29 different peer-reviewed papers. In the clinic at the Regenx headquarters, there's ongoing research and ongoing randomized control trials that are helpful for advancing the field and are helpful for developing new treatments that we're implementing all the time. And it also allows, the research actually allows for better outcome tools, so we can see what is possible. How are these treatments affecting people? What's working? What's not working? How do we change it? How do we make it better? Eugenics also has the world's largest safety paper, looking at any negative outcomes that come as a result of the procedure, and it shows the safety of the stem cell based therapies for all different orthopedic conditions. And it's a great paper because it basically shows that risks with these procedure are really negligible. The biggest complication from the procedures was mostly just discomfort at the injection sites, which is minimal. So what does all this do? This helps to kind of stack the deck in your favor for the patient. We're using doctors that are highly qualified with imaging that's very precisely guided to execute these treatments very effectively and very safely. We have the research and safety data that shows that these treatments work the way we want them to, and they're very effective for treating these types of issues. It's a personalized medicine approach. So, every treatment is different. Not everybody's pain is the same. Not everybody's pathologies are the same. So it's more concierge in terms of how we actually approach your treatment for your specific issues. But the way we have to do that is through evaluation and candidacy determination. So we have to see you. We have to be able to determine what we need to do, how we need to do it, and how we think that's going to affect you in the long run. We're also very transparent with with what we think and how well we think we can do in terms of your treatment, what we think your outcomes will be, and what the cost will be in terms of the procedure and the execution. So who are these treatments for? These treatments are for anybody that wants to avoid surgery, or people that have had failed surgery before, or know somebody that maybe had a bad outcome with surgery, or had a bad experience. People that want to keep all their parts, people that don't, that worry about metal being in their body, or other problems that come along with that. If you don't have a lot of time for downtime or for a lengthy rehab, we're talking about recovery within a few days, and then minimal rehab, outpatient rehabilitation after that. If you don't want to use drugs, or you don't want to have to worry about pain medications for after the procedures, or if you're too young for surgery, there are younger patients that come in with arthritic issues that they want to be addressed, and they don't want to start down the road of invasive surgeries early in life. So what are the results? The outcomes with this are good. There are a lot of good results that you see posted everywhere all the time, and that's real. People leave with less pain, increased function, improved mood. They're often, off of their pain medication, or off of chronic anti-inflammatories or other medications that they're needing. And it doesn't just apply to pain medication. A lot of people, when they can exercise better and they can move better, they're also getting off of blood pressure medicines and diabetes medications and cholesterol medicines. So you get back to a preferred active lifestyle. You're able to move better, you're able to work better, and just you feel better overall. So the next steps for any of you that are listening, I would say, make an appointment. You don't need a referral. You can call the office directly, and we can get you set up with an evaluation. Get your imaging together, MRIs or X-rays. If it's a year or two old, that's fine. If it's older than that, don't worry about it. Bring it. If we feel like we can use it, we will. If we feel like we need to get new stuff, we can. That's not a problem. I'll give you the number for the Regenx liaison. You can give her a call, and you can set up an appointment. We prefer in the office because that's an available, or that gives us a better idea of what we can do and can actually put hands on you. But if you're coming from a big distance and you want to do telemedicine, that's okay too in certain instances. We'll see if you're a candidate, and we can organize the treatment, and then we'll try to get you back to what you want to do. So step one, like I said, make an appointment. We're local. We're specialized physicians. We have the training, and we have the imaging, or some imaging, in-house to be able to help look at things there in the office. But we can also refer for any additional imaging if we need to. The exam is very important. We want to see how your body moves, how your joints move, how different things create or don't create pain for you. Like I said, we'll probably do some ultrasound examination in the office to look at the structures more closely. and answer any questions that you have right there in person. And then, we'll work on getting the treatment scheduled. Little to no rehab after the fact, minimal pain with little to no pain medications afterwards, minimal missed time with work or any other activity, back to life sooner than later. 4 reasons to take your health off hold. Avoid surgery backlogs and worsening of your condition. A lot of people, we were just talking about this on our radio spot last night. A lot of people feel like they need to just live with their pain, and that becomes really a part of their lifestyle. And there's really no reason to wait on this, and there's no reason to let the condition that you're battling against get worse. It's easy for us to get in there and try to, in any way that we can, get you better and get you moving better. Get back to your fitness, get back to your weight loss, get back to your healthy self. That's going to be much better for people in the long run in terms of just general health and wellness. Increase quality time with your loved ones. I mean, who doesn't love to be able to hang out with their husband, hang out with their wife, hang out with their grandkids, or their children? It's something that everybody wants to do. Everybody wants to be a part of the fun. And no one is really getting any younger. I always hear from patients, it's heck getting old. So you don't have to wait. We can try to get you feeling younger and feeling better and feeling stronger a lot sooner. Financial information. Insurance does cover any consultations with us in the office, any follow-ups that you have with us in the office, diagnostic testing if we need to order new imaging or lab work or anything like that. Also, any additional bracing or physical therapy after the procedure. What insurance does not cover is actually just the regenerative procedures themselves. So if we're dealing with prolotherapy or PRP or spine treatments or stem cells. But what a lot of people don't take into account is that a lot of times with your standard copays and deductibles that you're looking at for traditional orthopedic surgeries, sometimes the costs come out in the wash. You're looking at the copays for the surgery, the copays for visits afterwards, the copays for additional rehab, and a lot of times that rehab is prolonged. So there's a significant cost that even comes when people say that their procedures are actually covered by their insurance. But these are the procedures that we do are very customized treatment plans, and there's a very wide price range that comes into play with that. So don't be afraid to come in and talk to us and know what we can do for you and how that would work. So the next step for you guys, if you're listening, schedule a new patient exam. Come in and talk to us. Come in and see what we can do. Come in and see what we have to say. You can contact Sarah Furlan. She's our Regenex liaison on the phone. And you can schedule an in-house appointment or a phone consultation. The number is there, 412-963-6480. And we can get you all set up. So what I'm going to do now, I am going to introduce myself here. Hi, everyone. And I'm here. I'm listening, and we're open for questions here. So if you guys have any burning questions that you want to get answered, or anything that you feel like can you treat more than one area at a time? Good question. It depends on what we are treating and what we are using. Sometimes there are cases where we can do that if it's a more involved stem cell procedure for a large joint. Sometimes we just like to stick to the joint that we're focusing on, because that is helpful to focus the stem cells with what they need to do and what people need to heal. But I have had patients who have had both knees that are painful, and in those cases, I can treat one knee maybe with the stem cells if the one knee's worse, and maybe treat the other knee with platelets, because that's a much easier treatment to do. And a lot of times that is very helpful for patients and very helpful for alleviating pain in those scenarios. So that's usually how we approach it. Any other questions from anybody else? I know it's kind of a lot of information that comes at you all at once. But I'm here if you have anything burning, anything that you want to throw out there. If not, I will. Oh, here we go. Reading in the literature, the relationship of nerves to muscles. I'm in my late 70s and having a difficult time getting you. Okay. Getting up from a chair. Okay. Well, okay. So, you know, there are a lot of things that come into play with that. Number one, being in your late 70s is not too old. So that's not something that you should take into account as a limiting factor. You know, there's all sorts of different issues that we talk about with relationships of nerves to muscles. So there's numerous different pathologies that we can talk about there. But in reality, getting you in front of us and actually seeing what's going on with the problem, and actually knowing what the interplay is between the muscles and the nerves and the joint and how that's affected. You know, there's all sorts of different things. Can nerves be repaired to help muscles? If nerves are directly damaged, like if there's an actual nerve injury, like if a nerve is cut, then nothing that we will be able to do will be able to help that. But if you're dealing with nerve issues from a spine related problem like radiculopathy or stenosis or arthritis in the spine, then yes, there are treatments that we can do to help with that if we know what we're addressing and what we're looking at. So it's helpful again to bring in imaging and come and see us in person so we can give you a direct answer on whether or not we think we can be helpful. Good questions. Any other burning questions that anybody has out there? What's the typical recovery timeline for orthopedic knee surgery versus regenerative procedures? So with regenerative procedures, you're looking at probably about, so the initial downtime from the procedure is only about 2 or 3 days. That's the only time that we ever look at for true weight-bearing limitations. And depending on what type of regenerative treatment we do, you may not have any weight-bearing restrictions at all. So you may be able to walk right out of the office that day if it's a less involved procedure. With orthopedic surgery, you're looking at, you know, weeks, you're looking at months of recovery probably, you know, in terms of rehabilitation, gaining range of motion, reducing pain, all these other kind of things. So the rehabilitation process, like the actual physical therapy process, is only about a sixth of what you would normally see in an orthopedic surgery compared to the regenerative procedures. So with the regenerative procedures, the short answer is you're looking at a couple of days. With orthopedic surgeries, you're looking at you know, weeks to months, to possibly even years. But the other thing is that I also do not claim to be a surgeon. I'm not a surgeon. I'm a non-operative orthopedic specialist. So I don't do surgery. So I don't, you know, I try not to provide answers that a surgeon would be better suited to answer. Any other questions? These are great questions, guys. I'm glad you guys are asking them. I know, like I said, it's a lot of information to kind of take in and process all at once. Well, if there's nothing else, I really appreciate you guys being on tonight and attending. You know, if you think of any other questions or if there's anything else that comes to mind, please feel free to give our office a call. Like I said, 412-963-6480. Talk to Sarah. She can get you guys on the schedule and get you in for an evaluation. Or shoot us an email or ask any questions that you might have for our staff. We're happy to try to answer any questions that we can to make you feel as comfortable as possible when you come in and see us. Thanks, guys, for being with me tonight. I really appreciate it. Hope you learned something, and hopefully we'll get a chance to see each other soon. Have a great night.